A lot of people happy to hear that news from the governor today. The word is equity, making sure that those who are in the hardest hit communities get the doses they need.
That disproportionately has fallen on the Latino community in the state of California. African American community, yes, but disproportionately even more so on the Latino community in California.
And we are coming to you live from one of the Latino communities hardest hit, Boyle Heights. We're told by the governor the doses will be spread out among 400 zip codes statewide. About 8 million people we're talking about. Now, many of them in the Central Valley, but a lot of them here in Los Angeles County. The area is considered most vulnerable, and they determine that really not on race or ethnicity, but on household income, education level, housing status, and even access to transportation. We get reaction from a couple of people at clinics today.
Well, I'm happy to. This is the first one I'm going to get. I hope so. It's working very good, you know.
I think this is great. I think Monica Rodriguez is doing a fabulous job because, I mean, I've called and gone on the, on the internet, and no appointments, none available. And then this popped up yesterday.
Monica Rodriguez, one of the Los Angeles City Council persons fighting for vaccine equity. Another is Los Angeles City Councilman Kevin De Leon, who represents this district. I spoke with him about the governor's shift in strategy this afternoon.
It's a positive sign. It's a good sign. I mean, they're following the data, and the data shows clearly that you can look at certain zip codes and you see the hot zones, and you see the communities that have been ravaged.
So back live here, Alex and Chris, the stats tell us that about 17% of the vaccines that have been given out statewide have been given to those in the hardest hit communities. Now, 40% of all the allocations, again, dedicated to zip codes, low income, and other economic factors. This plan will only be in effect, though, for 2 weeks. Then they're going to reevaluate the whole thing again because we expect wider distribution of the Johnson & Johnson vaccine, which may alter the supply and change the allocation. Live in Boyle Heights, I'm Phil Schuman, Fox 11 News.
And Phil, the goal is to get at least 2 million of those 8 million people vaccinated, and then it makes it easier to reopen businesses, right? The calculations change.
Right. That's the whole idea, and it is a bit of a complex calculation, but shifting from the purple to the red tier is going to be easier when presumably the rate of infection goes down because of the increased number of vaccinations, yes.
And that means things like indoor dining coming back, movie theaters coming back, gyms, all with reduced capacity, much more likely because of this. Phil Schuman, thank you for your reporting tonight.